Thank you all for joining us today. As you have heard from me previously, this pandemic continues to pose a serious threat to the health of all Americans. I have said throughout my tenure at CDC that our guidance and recommendations will follow the science in our efforts to protect the health of as many Americans as possible. And today, we have new science related to the Delta variant that requires us to update the guidance regarding what you can do when you are fully vaccinated. The Delta variant is showing every day its willingness to outsmart us and to be an opportunist in areas where we have not shown a fortified response against it. This week, our data shows that Delta remains the predominant variant circulating in the United States. 8 in 10 sequence samples contain the Delta variant. In recent days, I have seen new scientific data from recent outbreak investigations showing that the Delta variant behaves uniquely differently from past strains of the virus that caused COVID-19. Information on the Delta variant from several states and other countries indicates that in rare occasions, some vaccinated people infected with the Delta variant after vaccination may be contagious and spread the virus to others. This new science is worrisome and unfortunately warrants an update to our recommendations. First, we continue to strongly encourage everyone to get vaccinated. Getting vaccinated continues to prevent severe illness, hospitalization, and death, even with Delta. It also helps reduce the spread of the virus in our communities. Vaccinated individuals continue to represent a very small amount of transmission occurring around the country. We continue to estimate that the risk of a breakthrough infection with symptoms upon exposure to the Delta variant is reduced by 7-fold. The reduction is 20-fold for hospitalizations and deaths. As CDC has recommended for months, unvaccinated individuals should get vaccinated and continue masking until they are fully vaccinated. In areas with substantial and high transmission, CDC recommends fully vaccinated people wear masks in public indoor settings to help prevent the spread of the Delta variant and protect others. This includes schools. CDC recommends that everyone in K-12 schools wear a mask indoors, including teachers, staff, students, and visitors, regardless of vaccination status. Children should return to full-time in-person learning in the fall with proper prevention strategies in place. Finally, CDC recommends community leaders encourage vaccination and universal masking to prevent further outbreaks in areas of substantial and high transmission. With the Delta variant, vaccinating more Americans now is more urgent than ever. The highest spread of cases and severe outcomes is happening in places with low vaccination rates and among unvaccinated people. This moment, and most importantly, the associated illness, suffering, and death could have been avoided with higher vaccination coverage in this country. COVID-19 continues to present many challenges and has exacted a tremendous toll on our nation. We continue to follow the science closely and update the guidance should the science shift again. We must take every step we can to stop the Delta variant and end this pandemic.